Tim and Stephanie, so Providence St. Vincent says this was a difficult decision to make, but they say that unit was empty for over 150 days last year and it just wasn't sustainable.
It is inherently operationally very difficult to run a low volume unit.
The pediatric intensive care unit at Providence St. Vincent will be shutting down permanently the first week of November. The hospital citing consistent low patient numbers.
Last year, our pediatric intensive care unit was empty for 155 days. And on days when it wasn't empty, typically we had one patient in the intensive care unit.
Now, families in need of that level of care will need to look elsewhere, like Legacy and OHSU.
There is a certain infrastructure that you need, even when there are 0 patients or 1 patient, that is expensive. So it's, the finances certainly make it more challenging, but even beyond that, there are inherent challenges with running a unit with very few patients in it.
In total, in 2024, Providence says the PICU saw 122 patients for the entire year. But nurses who work in that unit say there's reasons for that, with one being staffing.
It wasn't always that there wasn't a patient. It was we were constantly short nurses. There was multiple times we were short staffed and we were advocating to keep more staff on.
Erin Piltz, an RN who's worked at the hospital for years and is a part of the Oregon Nurses Association, is concerned about the timing, just weeks before respiratory virus season.
I feel bad for the community, and it is going to be felt within the community that there is going to be there's already a shortage of nurses in the other pediatric ICUs in the state, and now they're going to feel that even more.
Providence says it has a plan, and this is the best decision.
In advance of this announcement, I had a chance to connect with senior leaders at both Dornbecker OHSU and at Randall Legacy to let them know about our plans. I did that in August. Everyone in healthcare now is being really thoughtful about where they, where they spend the limited resources that they have, and we're no different in that way.
This does not impact the NICU or other forms of pediatric care at the hospital. Again, this unit will officially be closing the first week in November. Back to you.
Celine Stevens reporting for us. Thank you.